So this is Janice, right?
Yes.
Say hi, I'm Janice.
Hi, I'm Janice.
And we're doing an interview because you had, back in July, Bell's palsy.
Yes, I did.
And can you tell me what preceded that as far as, and what transpired in regards to what you thought it was at first and that kind of thing?
Well, it started out, I had a crown replaced, typical maneuver, and right after that I developed canker sores, quite a few of them inside my mouth. And then 10 days later, my eye wouldn't close and my mouth started to move to the side. I went to the urgent care and they said I was having a stroke. So they sent me to Crittenden Hospital because it was a stroke center.
All right, and then they found out what?
And while I was there, I still was not quite presenting as the Bell's palsy because it was taking its time showing all the manifestations. And finally they let me go because they said, yes, you do have Bell's palsy, you have all the earmarks of it. But mine went from my mouth, up my cheek, to my eye, my forehead, then into my ear.
Okay, and so here's a picture of what Janice looked like when we first saw her in the office. And so that's with her smiling and closing her eyes, and we can see that one half of her face just didn't work.
It was
and the other one did. So, okay, so you found out it was Bell's palsy.
Correct.
And then what was the advice given to you in regards to what to do about it medically?
Well, first of all, the hospital said you have to go to ENT, ear, nose, and throat specialist, and I didn't, and they kept calling me, so I went there, and when I went to the office, they said, would you like to attack it aggressively and get rid of it? And I said, well, what's the solution? And they said brain surgery.
Brain surgery.
And I would be out for probably 2 weeks to a month recuperating.
Wow. So what did you tell them?
I got up and left. I said, no, thank you. I'll go back to my own doctor.
So,
Dr. Johnson.
So you talked to me about it, and we said, oh my goodness. And you had to tape your eye closed at night?
I did. I had to put the special patch on it. I had to close it. I had to put special drops in my eyes because they were drying out.
And then how was it to eat and drink?
Oh, I couldn't. It was awful. I drooled like a baby, and food kept getting stuck in here, and I had to make sure that I swished it out. And it just wasn't pleasant to eat. I didn't want to eat.
Remember, your eye was even dripping.
Oh, it was.
It was just
That's
tearing.
right.
Just like drip, drip.
Constantly.
Yeah.
I couldn't stop it.
Well, we decided that we would do our procedures that we do here with regards to helping nerves heal. And we used laser.
Yes.
We sent you home with a Laser Touch 1 that helped with low-level laser and microcurrent electrical stimulation to use on your face, on the right side there on the facial nerve area.
Right.
We did Nambutapod's allergy elimination technique using herpes zoster virus vials and the facial nerve, which is cranial nerve 7 vial. And we did specific chiropractic upper cervical adjustments. We did some nutritional support for viral support that your body could help, get rid of the virus quicker.
Right.
We did neurocranial integration, which is a way to get stress off of your meninges, which is the covering over your brain and spinal cord.
Right. You mentioned PEMF.
We use pulsed electromagnetic field therapy, it's PEMF. And so we did this, and we took a picture, we did all these things over time. And it ended up taking just a little over 20 days.
2 weeks, Dr. J. 2.5 weeks?
Yeah. So it was all gone, and I'm going to post the pictures with the dates, as you can see the progression of you being able to close your eye. Then you were able to close your eye and your mouth wasn't as far drooped on the right. Then you could close your eye and sort of smile, and then you could fully smile. Then you were going on vacation, and we took these 2 pictures right when you were leaving.
Right.
And everything looked normal. And so have you had any residual problems since?
No, not at all. But they said I would have it for 3 to 6 months.
So 3 to 6 months, and then you were also told to have brain surgery.
Right.
And did you go back to the doctor, show him the results you got?
Yes, I did, and he couldn't believe it, and he just said to me, "Oh, you probably would have healed that quick anyway." I told him I don't think so.
Wow. Well, I'm glad we were able to help. I know you're glad we were able to help.
I was immensely
and I'm
glad.
hoping that this video will help other people who maybe are suffering with Bell's palsy to understand there's some alternative methods that can be used with great success.
Yes, thank you, Dr. J. I'm
You're
very
welcome.
grateful.
Glad to help. And thank you for sharing your story.